Hello friends, welcome to the Tutor Med channel. Gather around and let's simplify some medicine. In today's video, we want to discuss the ECG evolution of STEMI. This will illustrate the various ECG changes that can be recorded when a patient gets STEMI. Before we start, kindly hit the subscribe button and hit your notification bell for all updates on the Tutor Med channel. It is important for the clinician or the nurse practitioner to understand that the ECG of a patient with STEMI evolves through some changes over time. And this is important because depending on the time of presentation relative to the onset of the symptom, different patients with STEMI will have different ECGs. For example, if a patient A comes earlier after the chest pain, he may record some ECG changes which might be different from patient B who presents maybe 4 days later. So because of that, the onset of the angina pectoris or chest discomfort relative to the time of presentation must be sought. In clinical practice, most of our patients present within the first few hours of their presentation. Now when a patient gets STEMI, within the first few seconds, the first ECG change to occur is indicated in this diagram. This diagram shows a very tall T wave. And as mentioned, this occurs within seconds. And so the T wave here is described as a hyperacute T wave. Now because it occurs and disappears very early, this is not seen clinically, as most of our patients will typically not present within seconds after the chest discomfort occurs. After the hyperacute T wave, the next change is the ST segment elevation. And this change occurs within minutes to hours after the chest discomfort. This is a sample ECG on our right, illustrating the ST segment elevation. This dotted line represents the baseline, and this is the ST segment. And so from this baseline, you can see that the ST segment is obviously elevated. Now the ST segment elevation has two main morphologies. Although they can have other morphologies, we have two main morphologies, and they are concave up ST segment elevation morphology and then convex up ST segment elevation morphology. Now this diagram shows the concave up morphology as indicated by this red circle, and this shape, this concave shape, is further highlighted by the red ink. Then this diagram illustrates the convex up morphology, again as indicated by this red circle, and then the convexity is highlighted by this red ink on the left. This shape resembles the tombstone, and the reason why I brought this up is that the convex up morphology or the tombstone morphology is more indicative of STEMI compared to the concave up morphology. However, whether or not a patient has STEMI should not be based on the shape of or on the morphology of the ST segment elevation, but should begin with the history, the physical exam, and the ECG interpretation. So if the history is very suggestive of myocardial infarction, regardless of the ST segment morphology, if it diagnoses myocardial infarction, then it is myocardial infarction, regardless of the ST segment morphology. Alright guys, kindly like and share our video and subscribe to our channel if you have not done that yet. Very much appreciated. And so this picture depicts the next change. And these changes occur within hours, but in less than 24 hours, they should occur. And here, there is progressive loss of the R wave. In other words, the R waves decrease in amplitude. Then there is a development of pathological Q waves or deep Q waves. Then the ST segment elevation, begins resolving, or there is resolution, and then there is a terminal T wave inversion. Now let's compare this with the previous ECG picture we showed on the previous slide. Here is the R wave on the previous ECG, and compare it to the R wave here. You would appreciate that there is loss of R wave amplitude. In other words, the amplitude of the R wave starts reducing. And then, although this picture doesn't depict that, the ST segment elevation starts resolving, or even sometimes there is complete resolution of the ST segment elevation such that it normalizes. And then this is the Q wave on the previous ECG, and on this ECG, notice that it has deepened here, hence there is development of pathological Q waves, and then as you can see, there is T wave inversion as shown in picture C. Alright, next let's see this picture which depicts the next phase of the ECG evolution. The changes shown in this picture occur within days, and here we have a pathological Q waves as you can see, and then these pathological Q waves further deepen. Then next we have the T wave inversions which become more prominent, and remember these T wave inversions are post-ischemic, and the characteristic is that they are symmetrical, in that when you draw a line through the T wave you would have symmetrical halves. However, T waves, normal T waves, are typically asymmetrical. And as you can see, there is a complete resolution of the ST segment elevation. The ST segment has come back to the baseline. And this brings me to the point that although the criteria for diagnosing STEMI says that there should be new ST elevation, you remember that rule in our previous video, although it requires that ST elevation has to occur, you've got to realize that if the patient comes to you later, you might not find ST segment elevation. And the fact that we didn't find ST segment elevation on the ECG does not rule out the fact that this patient had a STEMI, had a transmural ischemia. Of course, had a STEMI if we do cardiac troponins and it's high, then this patient had a STEMI. And so the absence of ST segment elevation does not rule out the fact that the patient did not have a STEMI. If you have inverted T waves, remember we said that inverted T waves are a sign that the ischemia has already occurred or has occurred. The ischemia is not ongoing. And so if you have an inverted T wave and then you have a pathological Q wave, then it may suggest that this patient has had a STEMI. But because the patient presented later, when we did the ECG, the stage of the evolution didn't pick up the ST segment elevation. And so the point here is that although the ST segment here has normalized, the fact that the patient has an inverted T wave and a pathological Q wave tells us that the patient had a STEMI. And so the last phase is shown in this ECG. And the changes that occur here occur within several weeks or months post myocardial infarction, post STEMI. And so we have the persistence of the pathological Q waves, deep Q waves. And here you can see that the T wave inversions and ST elevation have all normalized. And then we have a persistent, or we have a normal R wave. And so the only thing that points to a past myocardial infarction here is the pathological Q wave. And so if you do a patient's ECG and you find pathological Q waves in contiguous leads, then it tells us that this patient may have suffered a STEMI in at least the past weeks or months. Alright guys, please be reminded to like and share our video and subscribe to the channel if you have not done that yet. And before you leave, kindly leave your thoughts in the comment section, leave your questions, let's know what you think about this video. So on this slide, we want to make some generalizations about the timelines at which these ECG changes occur, because in truth, the timelines for these presentations we have discussed really vary. And so let's make some general time measurements or time frames. And so let's begin with the first unit of time measurement, which is seconds. From seconds, what is the second unit of time measurement? The second in line is minutes. And so let's put minutes there. From minutes, we move to hours. And where do we go from hours? Of course, days. And from days, we move to weeks. From weeks, we move to months, years, etc. And so we want to say, having made these 5 general time measurements, we want to say that the first ECG change occurs within the first time measurement, which is seconds. And so hyperacute T waves occur within seconds. And then the next or the second ECG change occurs within the second time measurement, which is minutes. And so we have ST segment elevations occurring in minutes. Then the third ECG change occurs within the third time measurement, which is hours. And then the fourth ECG change occurs within the fourth time measurement, which is days. And then the fifth ECG change occurs within the fifth time measurement, which is weeks or months. And so this was just to simplify the timeline so that we don't get confused along the line. And so thank you for watching the video. I would not want to end by not telling you to like and share the video, and then subscribe if you have not done that yet. And please leave your comments in the comment box. See you in the next lecture. Bye.